To start out Unit 6, we will be looking at compliance and corporate planning. Regardless of an organization's size, specialty, or type of facility, compliance is a vital issue for continued operations. With all the laws, trends, and changes in healthcare, we need to ensure that we remain in compliance to reduce risk and liability issues. To properly face these issues, we need to create a corporate compliance plan and appoint a compliance officer to maintain the level of focus needed to remain in compliance with all the changes in legal statutes. As an added note, the Affordable Care Act does now require compliance programs for all providers who accept Medicare and Medicaid. So how do we start this process of compliance planning? The OIG has a website dedicated to compliance with program guidance documents, training materials, and educational materials. There are guidance documents for all areas of healthcare, including hospitals, nursing homes, billing agencies, suppliers, and many others, to help create and implement an internal control system to monitor compliance and create the organization's program. There are training podcasts and webcasts for providers that were created by HHS and the DOJ. Additionally, there are educational resources and materials for healthcare boards and physicians to help create a culture that is focused on high-quality care and compliance in all areas. Let's look at the components of a compliance plan. Just a bit of background to start. Compliance programs were created after the Federal Sentencing Reform Act of 1984, which created the guidelines that all publicly traded companies must submit an annual report to the Securities and Exchange Commission in response to the corporate financial issues in the early 2000s. The concept of compliance planning in healthcare was not new at this time, as we saw on the previous slide, with the creation of the OIG Compliance Education Planning, which was adopted in 1997. The purpose of a compliance program is to make sure that there are internal controls that promote adherence to all federal and state laws, as well as the programmatic requirements of health plans. These plans are really designed to create a culture within the organization that promotes prevention, detection, and resolution of issues that do not meet the laws and program requirements. According to the OIG, a corporate compliance program should have 7 elements. The first element is to create and implement written compliance policies, procedures, and standards of conduct for all employees within the organization. Second is to designate a compliance officer and a compliance committee that will then be responsible for monitoring the compliance efforts and enforcing the standards. The third element is to conduct training and education on these policies, procedures, and standards so that all employees are aware of them. Fourth is to ensure effective lines of communication to allow staff to ask questions and to have an anonymous reporting mechanism in place. Fifth is to have internal monitoring and self-audit set up to occur on a regular basis. The sixth element is to ensure that all standards are enforced and that disciplinary guidelines are published and well known to the staff. And the seventh element, to promptly respond to any offensive and create corrective action plans. These elements are quite similar to quality improvement efforts, so many healthcare organizations should have many of these elements in place already. So you can see how important compliance planning is to a healthcare organization as we think back to all the different laws and acts we have covered in previous units. Without some sort of plan in place, with oversight by a compliance officer, how can we ensure that we are in compliance at all times? The CCO is not an entry-level position. It requires someone who is used to being in a position of leadership and reporting to the board or to the stakeholders, as well as someone who is used to working with multiple departments at the same time. Most CCO positions require a minimum of a bachelor's degree with at least 10 years of experience in healthcare and leadership, but some organizations do require the individual to have a master's degree in addition to the experience. So we have seen why compliance planning is so vital to healthcare organizations. It's an essential part of management and leadership within the organization. For the compliance plan to be effective, there are 7 elements we discussed that must be present, including the Chief Compliance Officer, who serves as the point person for all compliance-related concerns, issues, and programs. Compliance is the best way we can ensure that we remain within the legal requirements for providing care in a safe environment for our patients.